Hello everyone, it's a new day and today we are going to have a presentation or a discussion on the topic irregular and delayed periods or menstruation. So this is going to be our presentation outline. We are going to have a look at some overview, the causes, treatment of irregular menstruation or delayed menstruation, and then we conclude. Overview. So we say during ovulation, an egg is released from one of your ovaries during a regular menstrual cycle. If the egg is not fertilized by sperm, then your body is signaled to shed the blood and tissue that line your uterus by changing hormone levels. This bleeding usually lasts 5 days. Then the monthly cycle starts all over again. However, some women experience abnormal uterine bleeding, which is another word for irregular periods. They have irregular periods if their menstrual cycle lasts less than 24 days, more than 38 days, or fluctuate greatly from month to month. It's typical for the length of a woman's menstrual cycle to fluctuate from month to month, especially if she is in adolescence, breastfeeding, or approaching menopause. Stress, drugs, and mental or physical health concerns can all have an impact on menstruation regularity. If the interval between periods begins to shift, you may have irregular periods. You shed more or less blood than usual during your menstruation. The length of your period varies significantly. So now let's look at some causes of irregular periods. Irregular periods, which is also known as oligomenorrhea, can be caused by a variety of factors. Many of these factors have something to do with hormone levels. The primary hormones that regulate the menstrual cycle are estrogen, progesterone, and follicle stimulating hormone. It can cause irregular periods if something disturbs or changes the way these hormones rise and decrease during each cycle. As a result, young girls going through puberty and women approaching menopause frequently experience irregular periods. Periods that are irregular on occasion are frequent and normally do not cause concern. But the following are some of the factors that may contribute to irregular periods. And the first one is natural hormone shifts. Now, the body goes through a lot of changes during puberty. The hormones that control periods can take several years to settle into a consistent pattern. It is usual to have irregular periods during this time. Irregular periods can also happen after a baby is born and while breastfeeding until the hormones return to normal. Breastfeeding, especially exclusive and regular breastfeeding, can stop a woman's periods by suppressing ovulation. Lactational amenorrhea is the medical term for this condition. During perimenopause, that's the earliest stage of menopause, periods become erratic as well. Hormone levels start to drop about this period. Periods may become longer and further apart until a person no longer has them. And also, hormonal birth control is also another cause of irregular periods. And with hormonal birth control, what we can say is hormonal contraception works by prevention works by preventing ovulation. What does it mean? This means that while using it, a person does not have a genuine period. Instead, some women do not have a period at all, while others get withdrawal bleeding that resemble a period. During the first few months of using the pill, patch, implant, or hormonal intrauterine device, that's IUD, a person may experience irregular bleeding. It's possible that this will become more regular over time, or that it will stop entirely. Similarly, if a woman stops using hormonal birth control, her periods may become irregular. It takes some time for the body's hormonal cycle to return to normal. After discontinuing birth control tablets, most people experience a withdrawal bleed that lasts, let's say, 2 to 4 weeks. A period is the next bleed. The cycle can take up to 3 months to settle into a regular pattern. People who had irregular periods before using hormonal birth control may experience them again once they stop using it. Also, stress is also a cause of irregular periods. Another cause is endurance exercise. Also, eating disorders is also another cause of irregular periods. And what we can say about this is absent or irregular periods can be caused by eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder. Now, if someone has lost a lot of weight, this is more likely to happen. The signs of an eating disorder can include extreme restriction of food or calorie intake, cutting out whole food groups from the diet unnecessarily, such as carbohydrates, fasting followed by binge eating, going to the bathroom immediately after meals, eating large amounts of food when not hungry. So all these are signs of an eating disorder. Now, having an intrauterine device, that's an IUD, can also cause irregular periods. Also, polycystic ovary syndrome is also another cause of irregular periods. Now, polycystic ovarian syndrome is a disorder in which the ovaries develop tiny fluid-filled sacs known as cysts. High testosterone levels caused by polycystic ovary syndrome can impede or postpone ovulation and the start of a woman's period. Now, pregnancy or breastfeeding can also cause irregular periods. Also, thyroid disease can also cause irregular periods. So, hormones produced by the thyroid also have an impact on metabolism, heart rate, and other basic activities. It also aids in the regulation of ovulation and periods. Thyroid hormone production is excessive in hyperthyroidism, while it is insufficient in hypothyroidism. Periods can be heavy or light, and they can be more or less frequent as a result of thyroid disease. In some people, it might also cause ovulation to halt. Symptoms of hyperthyroidism include anxiety, racing heart, trouble sleeping, irregular periods, feeling hot, unexplained weight loss or sometimes weight gain, Also, symptoms of hypothyroidism include fatigue, unexplained weight gain or sometimes weight loss, irregular periods or infertility, dry skin, cold sensitivity, depression, hair loss. Thyroid illness can be managed. Thyroid hormone may be required for an active thyroid, while radioactive iodine may be used to treat hyperthyroidism. Thyroidectomy is required in some cases of thyroid dysfunction. Also, endometriosis is also another cause of irregular periods. And endometriosis is a disorder that occurs when cells that normally grow inside the uterus grow outside of it. The uterine lining, which thickens and dissolves with each menstrual cycle, is made up of these cells. This periodic thickening and shedding causes substantial pain when the cells develop elsewhere. Other signs and symptoms include heavy periods, passing large blood clots, bleeding between periods, problems getting pregnant. Uterine fibroids is also another cause of irregular periods. Now, complications. That's complication that comes with irregular periods of menstruation. Period irregularities are rarely hazardous. Persistent or long-term irregularity, on the other hand, may increase the chance of developing other illnesses such as iron deficiency anemia. Now, iron is found in blood, and a person's blood loss may be sufficient to produce an iron shortage if their periods are heavy or frequent. Another complication is infertility. An ovulation, or when the body fails to release an egg, can cause irregular periods. This could indicate that a woman is having trouble conceiving. Another complication is osteoporosis. Ovulation is a source of estrogen, which aids in the maintenance of strong bones. Due to a lack of estrogen, a person who does not ovulate frequently may be at a higher risk for osteoporosis. Another complication is cardiovascular disease. Similarly, a lack of estrogen can raise the risk of cardiovascular disease. Another one is also endometrial hyperplasia. If a woman has irregular periods for a long time without therapy, she may develop what we call endometrial hyperplasia, a condition in which the uterus lining thickens abnormally. Endometrial cancer is more likely as a result of this. Treatment. How is irregular periods treated? It is usual to have irregular periods from time to time and does not necessitate therapy. In most cases, irregularities caused by puberty, perimenopause, or contraception do not require therapy. However, you may speak with a doctor if the irregularity is persistent and has no apparent cause. Also, if the irregular periods occur alongside other symptoms such as pelvic pain, you can also speak with a doctor if you want to get pregnant. You can also speak with a doctor if you miss 3 or more periods a year. You can as well speak to a doctor if you get your period more often than every 21 days. You may also speak with a doctor if you get your period less often than every 35 days. You may as well speak with a doctor if you are bleeding more heavily than usual during your period. You may also speak with a doctor if you bleed more than 7 days. You may also speak with a doctor if you have more pain than usual during a period. A doctor will be able to determine if there is an underlying cause. The treatment will be determined by the cause of the abnormality. The potential treatment recommendations may include the following. One is hormone therapy. So birth control, including estrogen and progesterone, can help boost hormone levels, counteracting the effects of not ovulating. To assist control irregular periods, doctors frequently prescribe birth control pills, that's oral contraceptives, containing the hormones estrogen and progesterone. It may also enhance quality of life by making bleeding more regular and simpler to regulate, as well as reducing the symptoms of disorders like polycystic ovarian syndrome. Progestin, a hormone medicine, can also help women who don't have periods acquire them. Another treatment is reaching a moderate weight. Menstruation can be affected by both a lack of body fat and an excess of body fat. So maintaining a healthy weight helps lower insulin levels in persons with polycystic ovarian syndrome who have a greater body weight. Lower testosterone levels and a higher risk of ovulating results as a result of this. Another treatment is lifestyle changes. Some women's periods are disrupted as a result of excessive activity. You may need to reduce the intensity of your workouts or exercise less frequently. If stress is the issue, knowing how to manage it as well as speaking with a counselor if necessary may be beneficial. Another treatment is nutritional therapy. A dietitian may be helpful if a person wishes to lose or gain weight, or if they have an underlying illness that impacts their nutrition. They can assist a person in determining the type of food that will best suit their needs and promote hormone health. Another treatment is mental health treatment. A doctor may offer psychiatric help if irregular periods are linked to stress, anxiety, sadness, or an eating issue. For the most part, this entails talking therapy with a psychologist. Regular treatment, nutritional counseling, and support groups for persons with eating problems will be provided by a multidisciplinary team. People who are severely underweight may require hospital treatment. Also, surgery is also another treatment for irregular periods. So, irregular periods can be caused by scarring or structural abnormalities in the uterus or fallopian tubes. If you know you want to have children, your doctor may propose surgery to fix any structural abnormalities or birth defects. This procedure can also be used to remove extensive scar tissue from the reproductive tract. Also, another treatment is additional medications. So people with irregular periods may benefit from certain drugs depending on the underlying cause. For those with polycystic ovarian syndrome, a doctor might prescribe metformin. This is an insulin-lowering oral medication for type 2 diabetes that can aid with ovulation and menstrual consistency. So, we come to conclusion. How are we going to conclude this lecture or presentation? Periods that are irregular and fluctuates in cycle duration are common. However, something may be impacting a person's menstrual cycle if they have very short or long cycles on a regular basis. Stress, normal hormonal changes, and starting or stopping birth control are all temporary reasons of irregularity. Period irregularities can also be caused by certain drugs and medical problems. A doctor will be able to diagnose the problem and make treatment recommendations if this is the case. People who want to get pregnant but have irregular periods should watch when they ovulate, or they should as well consult a fertility specialist. So we come to the end of this lecture or presentation. Don't forget to subscribe to this channel, like, leave all your questions or comments in the comment section, and share this video. Thank you for your audience and have a nice day.